we are living in a world where WHO is shouting at us and telling us that by 2030, 1 in 9 people will be having any type of cancer. So if we are 50 people in a room, you can calculate maybe 5 or 7 people amongst those group of 50 people are expected to have a cancer, and that is essentially developing, growing, increasing day by day because of the lifestyle parameters. So when we talk about these things, that's an impactful message that we need to give to the society what you need to be careful about.
Okay.
In terms of identifying your disease, in terms of early identification of your possible cancer that may evolve in the coming few years, and with that perspective, when we see that how do we diagnose these cancers?
Right.
See, when we talk about blood cancers in particular, the gateway to any type of blood disorders is a simple blood test called complete blood count, that is called as CBC. Almost 70 to 80% of the times, if any person for that matter has got any evidence of blood cancer, that will definitely show up in this blood test called CBC, complete blood count. So when in doubt, get a CBC done. If you have any symptoms that we shall be subsequently discussing about the symptoms, different symptoms and different presentations about different types of blood cancers, the gateway to those type of tests is complete blood count. Of course, if the blood CBC is showing something or there is some other allied tests that are showing some fishy things, in that case the next test that is required is to undergo a bone marrow test that is sufficient enough to diagnose a leukemia or a multiple myeloma. In cases of lymphoma, however, more likely the diagnosis is to come by a test called lymph node biopsy. So there is a misconception that most of the times if you go to some sort of rural area, if there is swelling in the neck that we technically call as a lymph node swelling, most of the times the rural practice is that they get a FNAC done if at all required, and that most of the times misses the diagnosis of lymphoma. So one very clear message that I want to give here is, if you have a cervical swelling, if you are swelling in the neck, in the armpits, in the inguinal areas, get a lymph node biopsy done. Maybe a FNAC, that is a fine needle aspiration, might not be sufficient to pick up a dreaded disease like lymphoma that of course in 2025 that we are talking is curable.